afternoon to you. Thank you so much for coming through.
Good afternoon to you too and the viewers.
Now, as I said on my introduction, that of course the board says this is the step in the right direction. Your take really on this latest version of NHI bill?
I think it's a definitely better version, just from the presentation, a better version than what was published last year. However, as a solution to one of the problems, it's a necessity that we need. The funds are allocated in an inequitous way in the country, and this is a solution that will address the funding components of healthcare delivery. There's a service component, there's a regulatory component. All of those need to be fixed as well.
All right, so if I understand you correctly, this is not entirely the solution to the rest of the problems that we have in the healthcare system. This is just part of the solution.
It's part of the solution. You have to do a multi-pronged approach to fixing the solution. When they presented this, they commented there are 12 or other legislations that need to be changed and fixed. Obviously, those are changed at the legislation level. Then you need to change it at the implementation level as far as the regulatory concern. There's no doubt that the service provision side and the management in those areas also need fixing. This is just a component on how we will redress the funding component of healthcare. So instead of money going to the provinces and provinces decide how they want to spend money in healthcare, now it will go to a central pool. You separate funding from service provision, and that starts introducing an element of accountability in the health system, which is a good thing going forward from a governance perspective.
I think what many people have been seeking to understand with this NHI is what happens then to those who have medical aid?
As I said, the NHI will be fully implemented, or they predict it will be fully implemented by 2026, give or take a few more years. That means for quite a few years from now, medical aids will potentially continue. Similarly, as they've been doing now, there was the medical schemes bill that was proposed last year. It will potentially be finalized as soon as the health market inquiry has completed their work. So for the good while, there will still be scope for medical aids. They do propose that they continue with the agenda of the complementary cover, but I think the details in the way this is written up has changed, and I think we need to unpack that a little bit, do a little more analysis to fully understand what is actually meant by that. They talk about potentially the minister will pass regulations when it is fully implemented. So I think we need to then define what is fully implemented, and I guess those definitions and those details will come in regulations and through further engagement.
Yeah, because part of what I read about medical aids in this regard is that eventually when that time comes, they will be sort of relegated to providing just top-up covers.
Similar to an insurance, yes. That's what's been proposed, but I think it's more important to get the details and fully understand the situation.
So the bill, as we said, it acknowledges that in order for this to work, there needs to be changes, as you said, and the system must take place regularly. On what possible changes do you think we're looking into here?
There's going to be massive changes to the health system. Massive changes, largely because of the fiscal federalism and how provinces are funded. The Treasury passes on money to the provinces and it's allocated through budget. That's going to change. So money that has been allocated to budget in that way now goes to the NHI. The province has to deliver service, for that they will get money. And that changes the picture completely. So currently, if they don't deliver on service, the money still comes. In future, they will have to deliver on quality service before they start seeing the money. Similarly to you and me, we don't just get money into our bank account, we have to work for it first.
We have to work for it first. Foreigners, really, will they also be entitled to free healthcare services under the NHI?
In a limited way. I think that's been described in detail. So some foreigners, unregistered, etc., will get emergency cover. They talked about the notifiable disease. These are of public health interest, and they will cover those components because that's, I think, a constitutional mandate. There's an expectation foreign visitors to South Africa will have to come with their own insurance component, so that South Africans are not burdened looking after them when they do become ill here in the country. So they start looking after themselves in general. There's a whole lot of issues about refugees, etc., that is defined, and I think we just need to have a look at the details of it. Who's covered, who's not covered. I recall there was something where prisoners being covered, all children will be covered, South African citizens and permanent residents as well. So permanent residents, yes, if you call them foreigners, they will be covered as well.
Now, as you say, Doc, that we know, of course, it was piloted in some areas in South Africa. your take really on the results from there, because you're saying that now it looks like this is a better version of what we had previously. There is more understanding and more clarity now on what this NHI bill seeks to achieve.
I'm not sure if I would really classify those as pilots. They were known as pilot sites, but more to identify the issues and what are the requirements for the implementation of such transformation in the health system. So they weren't specifically NHI pilot sites per se, where you change the whole nature of the funding component. So I think when you look at those components, is the details of the published results was there were certain gaps, etc. The question going forward is, in the service provision, what are you fixing, how are you going to fix it, etc. Are you going to put the correct leadership in place, correct management in place, correct staff requirements in place, etc. Those all need to take place for the whole system to be fixed.
Yeah.
You know.
All right, so for someone who's watching this interview and really wondering and is not able to sort of understand, let's just break this down and bring an understanding as to, once this is fully implemented in 2026, what changes will we be able to see? Because now we talk about long queues at your public hospitals, public clinics. We talk about what people term birth services from healthcare facilities. So will there be any noticeable changes that we will be able to see as ordinary South Africans?
Honestly, I wouldn't speculate on those components right now. This is just the legislation. Legislation allows you to set up framework. Yeah. And this is framework for financing, nothing else.
The reason I'm asking you this is that a lot of people are of the view that we have beautiful policies, beautiful legislature on a piece of paper, but the implementation part of is what the problem is. Yeah.
This is why I'm saying I'm not going to make a decision on what it's going to be like in 2026.
Yeah.
I think it's the right step. The question then is, are we going to support them? As I said, BHF has supported the NHI proposal and policy right from the late 2000s. We believe it's the right step to go in the direction of fixing the health system. But to us, take one step at a time. Right now, it's been tabled to Parliament. Let's understand this legislation proposals. Let's identify the weaknesses. Let's make sure this legislation is structured correctly. In the lieu of the governance problems we've had in other SOEs in government over the last few years, let's make sure there's correct governance for this in the structure here going forward. So let's make sure that when this legislation goes through Parliament and the President signs it, that it's a legislation we're all buying to and it's a good legislation.
Yeah. But there has been proper consultation, isn't it?
And there has been a lot of consultation. Yeah. I can say categorically that the input BHF had made at the time of the Ministerial Advisory Committee and the Green Paper made it to the Green Paper. There was a lot of inputs we've made along the way as well, and we've seen it being included to the extent that obviously
so there is hope
the
at
review
the end
in
of the day.
This is why we're reasonably comfortable. We welcome it, and we all welcome the ongoing engagement.
All right.
And I think everyone must do the same.
All right, Dr. Patel, we'll leave it at this. Thank you so much for coming through.
Thank you very much.
All right,
Thanks
well,
for
there
the
you
invite.
have it, Dr. Rajesh Patel from the Board of Healthcare Funders of Southern Africa, talking to us about the National Health Insurance Bill, of course, as you may have had the latest this afternoon. We are taking a quick break here on SA Today.